Well, I looked at the agenda for today and I saw that I was in very illustrious company, and then I thought to myself, well, I'm probably about as qualified to talk to you about what patients with rare cancer want as Mel Gibson was to tell women what they wanted. So that's my disclaimer up front. What I can talk about though is why we should be asking this question, what do patients really want, and how we've gone about asking and trying to answer that question, and what we plan to do with those answers. So we've come a long way. We've heard this morning about the incredible developments in technology in cancer over the years, and we're at a stage now where we've moved away from this very paternalistic approach to medicine, and you can see here I've got a bit of a rugby reference. I couldn't resist with the World Cup on at the moment, but I think there was a time where this was very much the experience of anybody going through any kind of serious health crisis or challenge. They were the patient packed in with the scrum of medical professionals, all with an opinion about what should happen and how it should happen, and really no voice of their own or opportunity to make any decisions whatsoever. So I don't know whether some people might still think that's the good old days, because sometimes having decision-making ability is a bit of a curse. But this is more the scenario that people in the health profession are confronted with these days, where the patients often have done quite a lot of research, and when you start thinking about rare cancers, and particularly at a primary care level, you can imagine that quite often the patient will be confronting their doctor, their carer, with loads of information that they've sourced online. The validity of that may be sometimes questionable. Nevertheless, they're going in prepared and empowered with knowledge and information and wanting to ask questions and make choices. And whether the medical profession likes that or not, that's the new world that we operate in. So with that comes responsibility, and as a daughter and a granddaughter and a wife and a mother and a sister, I'm quite often part of that decision-making process when it's my loved ones that are involved in some kind of health challenge or crisis. And so whether you're the cancer patient yourself or closely affiliated with someone who's going through an experience, you know that sometimes it's not just a question of, well, I want access and that's it. It's not that simple. It's a case of, all right, well, what are the choices? Are there choices? And it's usually a trade-off. Well, it's always a trade-off. When it comes to accessing new pharmaceuticals and new treatments, we have processes, we have a system that's served us well for a long time in Australia here, and which at one point I think was probably the envy of many around the world. But there's no doubting that it's struggling to keep pace with the rate of advancement in treatments, with the changes in the way we practice medicine. That was what this morning was all about, hearing about that journey and how we've moved on and what the future holds. So we have people that are appointed to make value judgments about which of these things should be approved, should be paid for and funded by the taxpayer, and they're weighing all sorts of social considerations, financial, but what they're not really weighing into that equation is, what does the patient want here? And of course, this is all very much a matter of perspective. What the patient wants may not be what the carer wants. It may not be what the clinician thinks is the best thing, and it's going to be very much shaped by the experience of the person in front of them. So you can imagine, for example, we've undertaken an exercise to start asking patients what they think, and we're gathering data through this survey that Simon's going to speak you through this afternoon. We're asking them to make those judgments, those decisions, and depending on where they are in the course of their journey, their answers are going to be quite different. Someone who's just been diagnosed with a very rare cancer that has limited information may have quite a different view to someone who's already undergone certain treatments, experienced certain side effects, paid certain amounts of money. So what we need is a process and a way of capturing that information, a way of understanding what it is the patients really do want. And we're not talking about a homogenous group of people here. Just as we're talking about every cancer being quite individual, so is the needs of the individual patients. but it's about having an understanding of the things that matter and how people make those decisions and weigh those decisions, and also providing a mechanism for our decision makers, the people who decide which medicines are going to be made available for people. It's about giving them the tools to be able to incorporate that perspective into their decision making. So without further ado, I will hand over to Simon. I think Sophie's going to tell you a little bit about his background, because this is the approach that Janssen has taken to answering this question about what patients want and how we're going to use that information. Thanks.